the flawed logic behind walk-in centers. At the same time, the NHS launched walk-in centers, clinics primarily led by nurses designed to improve access and reduce pressure on family physicians. The idea was simple. If more people used walk-in centers, general practices would have shorter wait times. But a major study in the British Medical Journal, BMJ, found no evidence that walk-in centers actually reduced waiting times in general practice. The logic was flawed, and people continued seeing their family physicians, and now an additional layer of healthcare costs had been introduced. Despite these warnings, the UK government doubled down. They licensed nurse prescribers and pharmacists to diagnose, prescribe, and refer patients for specialist care, bypassing doctors entirely. Dr. Srivatsa's ethical stand and the creation of Maya. As a medical educator, Dr. Srivatsa was deeply concerned. He saw firsthand the delays, misdiagnoses, and unnecessary antibiotic prescriptions that resulted from protocol-driven healthcare, where decisions were made based on statistical models rather than medical expertise. He tried to introduce a color-coded system to streamline patient care. His plan was simple: red symptoms, see a doctor immediately. Green symptoms, consult a nurse. This system would have improved efficiency and protected patients from delays and misdiagnosis. But the nurses refused, claiming they were independent nurse prescribers and would follow their own guidelines. The system was never implemented. At this point, Dr. Srivatsa realized he needed a new approach, one that could bypass bureaucracy and truly put patients first. And so, the idea for Maya, medical advice you access, was born. The battle against negligence and the NHS cover-up. When Dr. Srivatsa raised concerns about patient safety, he was ignored, silenced, and victimized. He made a protected disclosure to expose the negligent care in the NHS, informing the General Medical Council, GMC, and the British Medical Association, BMA. But instead of addressing his concerns, officials leaked his complaint to the very nurses he was reporting. What followed was years of retaliation, legal battles, and personal destruction. He lost his career, his health, and his financial stability. The Secretary of State, Patricia Hewitt, even granted nurses and chemists the right to diagnose and prescribe, a move that blurred the lines between doctors and non-medical professionals. But despite everything, he refused to give up.